today my topic to inform you about is neurosurgery. Neurosurgery is amongst the most bold and complex job choices that you can choose from. Through one scalpel, a vast amount of technological utilities, and sheer will plus determination of this around the table, your life as you know it is in the hands of somebody else, and that somebody else is a neurosurgeon. The purpose of this speech is to inform you and explain what being a neurosurgeon is really like, and what it takes to become a neurosurgeon. More specifically, I will be discussing neurosurgery and how it takes a lot of time, effort, and skill. Now let's dig a little bit deeper. What is it actually like to be a neurosurgeon? Well, in this article called "What's the Difference Between a Neurologist and Neurosurgeon?" written in 2019 by Janssen Health and published on January 29th in 2019. Being a neurosurgeon, you will operate, examine, and diagnose. When you operate, you're going to be operating on things such as tumors. You're going to be taking them out, and you're going to be relieving stuff like chronic pain, and you're also going to be operating on treating wounds. When you examine, you will be observing the extent to injuries. You will be checking MRI and CT scans. And lastly, when you diagnose, you're going to be diagnosing disorders such as MS, Parkinson's disease, and Alzheimer's. Those are just 3 examples, but there are many more, along with spinal cord injuries and injuries of your head. Now that you know what being a neurosurgeon is like, let me tell you about the difference between neurosurgery and other specialties. So, how are neurosurgeons different from other surgeons? In this article called "Neurosurgery versus Orthopedic Surgery for the Spine," written by Atlantic Brain and Spine and published on March 3rd, 2020, they discussed how neurosurgeons don't only do surgery most of the time. Unlike other specialties, for most cases of neurosurgery, they do prolonged treatment. Once the surgery is done, they have many follow-up visits, and before and after surgery, they could do non-surgical work. And this is the least picked specialty. Compared to the other specialties such as orthopedic surgery and pediatric surgery, neurosurgery is 10 times less likely to be picked. So now that you've heard the differences, what are the necessary factors to become a neurosurgeon? Well, this article called "So You Want to Be a Neurosurgeon," written by Women in Surgery in the year 2009 and retrieved in 2009, it takes about 14 years of school. The reason it takes 14 years of school is because straight after high school, you go to your undergraduate where you get your degree in whatever you want to be. Most of the time it's biology, and and that usually takes around 4 to 6 years. Then after undergraduate, you go to medical school and you spend another 4 years there. And that's where you will be doing your clinicals and learning about the different types of surgery. And that's where you will pick neuro. After all of this, you go into your residency, which could last anywhere from 5 to 10 years. Because after residency, you can go to a fellowship. In order to follow through with this career, you're going to need a lot of drive and work ethic. A surgical residency is said to be one of the toughest things a person can put themselves through. And that's that's one of the reasons is because you spend about 95.8 hours a week at the hospital. You spend more time at the hospital than you do at your own house. So if there's anything you should have learned about that, it's the fact that neurosurgery is one of the most extensive jobs you can pick from. And this job is not for the weak at all. Now that we've dug a little bit deeper, it is evident that being a neurosurgeon takes a lot of time, schooling, and effort. In order to become a neurosurgeon, you will need at least 14 years of school, an extreme amount of work ethic, and a great background on the anatomy of the brain, and so much more. Doing such a complex job every day, you're going to be faced with challenges and obstacles, and every single day of your life, you're going to have the life of somebody else in your hands. Through every surgery, you will be overseeing an entire team through surgeries that can change the quality of some people's lives, in a good way or a bad. Thank you. That's all I have for today.